It's Patrick Hutzel from intensivcarehotline.com with another quick tip for families in intensive care. So today's tip is a question from Mark, who says, my dad is ventilated in intensive care. He's got high blood pressure when he's being weaned off the ventilator, and therefore they can't extubate him. Extubation is the removal of the breathing tube. What should we do? Great question, Mark. And, I've seen this, I don't know, dozens of times, hundreds of times. I've worked in critical care for nearly 25 years in 3 different countries, where I also worked as a nurse manager for over 5 years in intensive care. And we've been consulting and advocating for families in intensive care here at intensivcarehotline.com since 2013. And it is very fair to say that we have saved many, many lives here with our consulting and advocacy. And you can verify that on our testimonial section at intensivcarehotline.com or on our podcast section where we've done some client interviews. Coming back to Mark's question. So when someone is waking up from an induced coma and their blood pressure shoots up, it is often a sign of distress. It is often a sign of confusion, agitation. So imagine this, someone is in an induced coma like your dad. They've been, quote unquote, asleep, chemically kept asleep, and then they're waking up. They have no recollection of what's happened. They have no recollection of why they are, where they are, why they are in intensive care. Someone might explain it to them, but they can't talk because of the breathing tube. So it is an extremely distressing situation. Now the issue here is that the longer someone stays in an induced coma, the more deconditioning there is and the more time patients need to spend to rehabilitate, to get their energy back, get their strength back, and so forth. So minimizing the time someone is being kept on the ventilator is, on the one hand, very important. On the other hand, it's also important making sure that patients can deal with the critical illness, and sometimes that means a patient needs to stay in an induced coma for a little bit longer so they can fight the critical illness. Now, if your dad is already strong enough and he's breathing by himself and he's obeying commands, but his blood pressure is shooting up, it's most likely a sign of discomfort, right? And if he's strong enough to breathe, if he's strong enough to cough, if he's obeying commands, right, his blood gases are good, there's minimal secretions, right, then he should be extubated, and you will find that his blood pressure will go down. I've seen it many, many times, right, where the cause of distress and high blood pressure is simply the breathing tube. It is extremely uncomfortable having the breathing tube in your throat, right, cuffed with a balloon, right, and air is being forced into someone. And that's all well and good if someone needs an induced coma, but your dad might be ready. That part I don't know. But if his blood pressure is high, there's a very good chance it's simply distress, it's pain, it's discomfort. And by taking the breathing tube out, you're eliminating that part of stress. Once again, your dad needs to be awake. He needs to have passed the spontaneous breathing trials. He needs to be off sedation and opiates. His arterial blood gases need to be within normal limits. His chest x-ray needs to be clear. I have written an article, How to Wean a Critically Ill Patient Off the Ventilator and the Breathing Tube, that I will point towards below this video in the written version of this blog. And you can read there what boxes need to be ticked before you can extubate someone. But most of the time, also, if your dad doesn't have a brain injury, if your dad has a brain injury and can't control his brain and he's not able to obey commands, he might not be able to swallow, then taking out the breathing tube might be too risky, right? Nevertheless, if he's got a brain injury and the breathing tube is troublesome for him, right, and that's causing the high blood pressure, then he might need a tracheostomy, right? A tracheostomy is nowhere near as uncomfortable as a breathing tube in the throat, right? So I hope that answers your question, Mark, of what the next steps are here, right? And you know what to do next. But the best case scenario here is take the breathing tube out and your dad's blood pressure will go back to normal, right? And even if he does need a tracheostomy, if he can't breathe, if he can't obey commands, best case scenario would be a tracheostomy. tolerate that much easier, and his blood pressure might also go down. Now, on the other hand, if it is a real blood pressure issue and it's got nothing to do with the breathing tube or discomfort, he probably needs to be seen by a cardiologist, and his medication might need to be optimized. That is another option here as well. So is he on antihypertensives like anti-blood pressure medications? It's also a question you need to ask, and he might need to be reviewed by a cardiologist. You know, also if he does have ongoing high blood pressure, there's also a much higher risk of a stroke. So please ask all of those questions. So I hope that answers your question for today. Because we get so many questions for families in intensive care, or from families in intensive care. That's why we created a membership for families of critically ill patients in intensive care. And you can become a member if you go to intensivecarehotline.com by clicking on the membership link, or by going to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos where I share all of my decades worth of intensive care nursing experience. And those ebooks and videos, plus the access to me and my team, will help you to make informed decisions, have peace of mind, control, power, and influence. I also offer one-on-one consulting and advocacy over the phone, Skype, Zoom, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I handhold you through this process, making sure you stay 2 steps ahead of the intensive care team, so you manage them and they don't manage you. I also talk to doctors and nurses directly, and I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care, all with the goal of you making informed decisions, having peace of mind, control, power, and influence. Making sure your loved one gets best care and treatment. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also offer medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have. Share this video with your friends and families. I also do a weekly YouTube live where I answer your questions live on a show, and you get notification if you are a subscriber to my YouTube channel, or if you are a subscriber to our email newsletter at intensivecarehotline.com. Also, comment below what you want to see next, what questions and insights you have. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.